Check out the latest highlights from the Nourishing You podcast.
I know, as we started talking about food, I started thinking, there's a lot of people that think when they start to apply some kind of a food plan to something, a condition that they care about, they also start to think about supplements too. And I know that there are so many bone health supplements on the market. Can you give any guidance as to which nutrients, if somebody needs a supplement, they should pay more attention to versus not? I'm not asking for an overall recommendation because everybody's different and unique, but I'm sure there are certain nutrients that matter more if somebody is going to choose something like that to augment their diet.
You're right. And I think augmenting their diet is an important concept. I do believe that dietary supplements should be used exactly as they're intended by the FDA and as the name is explicitly intended to convey. That is a supplement to a good diet, not a replacement for diet. Right. I think that your question, though, for me is important then when in answering it, to step back and say, okay, what is the most important question with osteoporosis? And how do dietary supplements relate to that? So a little earlier, I said, you can essentially frame any recommendation and view any recommendation through the lens of one simple question. Has what I'm being recommended been shown in clinical trials to reduce fractures? And so we can look at the dietary supplements and the nutrients used in dietary supplements through that lens as well. There are only 4 nutrients actually that have been shown in clinical trials to maintain strong bones as indicated by reducing fractures in clinical trials. Those are calcium and vitamin D, a form of vitamin K2 called MK4. Now, there are 2 forms of vitamin K2 people are probably familiar with that are in dietary supplements. There's MK4 and MK7, but they have different names. And as you might sort of understand, they're different molecules, although they're both forms of vitamin K2. In biochemistry, if you change one atom, one carbon atom, for example, it can change the activity of the nutrient. So MK4 and MK7 have overlapping but different roles and activities in the body. MK7 has never been shown in any clinical trials to reduce fractures as the endpoint in those clinical trials, showing that it maintains strong bones. Both MK4 and MK7 can promote and boost bone mineral density, but bone mineral density only predicts 44% of women who will break a bone and only 21% of men. In contrast, the MK4 form of vitamin K2 not only promotes healthy bone density, has been shown to promote healthy bone marrow with healthy platelet production and red and white blood cell production. It's the primary form of vitamin K that accumulates in tissues throughout our body. So MK4 accumulates in the brain, in breasts, in the intestines, in the pancreas, in the testes. And so it suggests that it has a lot more activity in the body beyond just bones. But with respect to bones, there are clinical trials. There are 5 clinical trials that actually looked at whether MK4 can maintain strong bones as indicated by reducing fractures.
If you enjoyed this short episode, check out our full library on our NAMP YouTube channel, where you can catch up or learn more. Keep in mind that the information on the NAMP podcast is for educational purposes only and should not be considered medical or legal advice. The NAMP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NAMP and all agents. Copyright NAMP, all rights reserved.